morning. We're going to talk about dental implants today. We see the ads and we see so many things out there right now with dental implants, and it's hard to decipher quality, good implant care and everyday implant care. Um, Through the years, and we've been actually dabbling with dental implants since the middle 1990s, and we've seen how implant dentistry has changed and become better and better with each step every day. So, let's talk about what we used to see and what we see nowadays. So, back in the day, we were just really lucky to even have dental implants. In my day, when I was in dental school, what we heard of were just rumors that someday we would have a dental implant and we could put a crown on top of it. And today, that is very much an everyday reality. And as we've improved the systems through the years, what we found is how to make dental implants more biologically and physiologically compatible with the human body. So when we start looking at successes, early on we set the bar high. We were really critical about the patients that we selected and the sites and the positions that we selected so that we could do good dental implants. And our success rates back in the day, even with our early systems, were in the 90+% success rates. Nowadays, 95 to 98 is still our expectation, and we probably still exceed that. With the newer systems, they are so compatible with the body bone-wise and tissue-wise. We find that not only do we get great integration and great success, but the longevity is increased remarkably so. So what do we look for when we're looking for a today quality implant? The implants that I would recommend nowadays would be the bone-level implants. There's several brands that make them, and what sets them apart is the restorative system. And so most companies now can produce a dental implant that will integrate well with bone. However, the restorative platforms that are available to the general dentist and the prosthodontist are limited in some cases, where actually in the past, where we didn't have these everyday pieces, we had to custom fabricate. Nowadays, with a good impression and position of the implant, we merely ask our labs to custom fabricate parts and create ideal results with what we have. So, that being said, what does a good quality implant have? Like I mentioned earlier, the bone level ones are probably the best. Those are the ones that I would recommend. The second thing is, why a bone level? And why the bone level is that the connection between the dental implant and the restorative abutment seals the best and moves the microgap, which was our nemesis in the past, further away from the crest of the bone. So by doing so, what we see is that there's less bacteria, less irritation for the body, and the bone stays more stable around the implant itself. In years past, with the microgap at times being closer to the bone, we often saw bone loss around the top of the implant. So nowadays, we've mitigated that problem because we get great seals and we've moved the microgap away. Now, quality parts also go with the quality implants, and having parts that fit well to the interior of the implant and seals the implant correctly is also critical. So the more intimate the abutment fits into the implant, the more stable the abutment is, and therefore the crown and or prosthesis above the implant and abutment is more stable as well.